Good evening and welcome. What a day. Tuesday today. I think it's around about what? 6, 7 days to go to Christmas. Christmas time. Anyway, we have got Dr. Monica on today and she should be on in a minute, hopefully. And so leave your messages through and I hope you're okay. Let's go into the book. Aileen. Oh, Aileen, I've got your Christmas card. Thank you very much. I have got your Christmas card. So there you go. Only one Christmas card, though. Only the one Christmas card. Only the one. So here you go. Right, I'm just waiting for Dr. Monica. As soon as she comes on, we'll be rocking and rolling. Rocking and rolling, rocking and rolling. Let's go to the house. Anyway, don't forget, we've got another show tonight around about 9:30, and we ain't got no other shows before then, so it's only 9:30 tonight. Um, and that's it for tonight. I'm afraid I'm gonna have a quiet night tonight. So after this one, I'll be finished then till 9:30 tonight. So, ooh, I'm hoping I can watch cooking later. I'll get around my wife. So anyway, I'm just waiting for her to come on and see what's happening. So it shouldn't be long now. Oh, and we got the zero.
Hello,
Hello,
finally.
hello.
Hello.
How are
Hi.
you?
Can you see me?
I can't see you. I can hear you.
Oh, oh. Uh,
You have to turn your camera on.
hear you. A camera mic. Let's just see if it will work now. Front camera. Mm, hmm, take it out. Yeah. Camera here. Oh,
That's
now.
better.
I guess it's always we have a little bit adventure with start, but always we're finishing right. So it's all on positive side.
Good afternoon, Dr. Monica. I hope you're well.
Doing well, doing well. Pleasure as usually. Welcome you and welcome your audience.
I want to talk about today about obesity, and I know you are very clued up about obesity.
Mhm.
And could you tell me if someone is overweight, how can they kind of try to lose the weight if somebody is going for an operation?
Uh, Before operation, you need to have appropriate preparation. You probably know about minimum 6 months being under physician supervision, which is done in weight loss center, which I have privilege to work. You also should be seen by exercise physiologists at the same time, by nutritionists, and be able to apply during these 6 months diet, exercise, and of course, uh, what we call applied science of mind. It is science which will allow you to stay motivated and not destroyed by quite vigorous process. So as you know, the whole family has to be involved during this time. So whatever you buy, your wife will support or significant others. There are no bunch of cookies, no chips, no sodas, and no two different type of meal which are going to increase cravings during this time. So yes, I did work in places like that. In first in at University of Connecticut, it was in one of associated hospital, and I also work in weight loss centers in Warren, PA, cooperated with Magnet Place in Erie. And quite interesting, you will see people who during 6 months will lose weight and they will decide not to proceed with surgeries. Then after surgeries, they will refer to me with diverse amount of challenges. You probably know about gallbladder. Majority of people, gallbladder quit working appropriately. There's also decreased absorption of vitamins such as vitamin A, vitamin D, as well as digestion of fatty acids is more difficult. So people need digestive enzymes, or in addition, we recommend as holistic, realistic doctors. I always say holistic, realistic, not somewhere in clouds. Probiotics or fermented foods, and in addition, we watched body composition because it's quite drastic change to a point when people's skin is, let's be objective, body mass is suddenly changing dramatically, and muscles are not built to the point to replace significant amount of fat tissue. So as a result, people develop what we call paniculitis, which is amount of stored fat tissue, or I saw women whose back of the arm just will hang down. So sometimes it requires surgeries. What else we observed during this time? Immunity level may change. I forgot to mention iron absorption. Quite significant malabsorption we observe with iron. And then how do we proceed through time of excitement when everything is melting down, when attention from significant others, from friends, is just becoming very prominent. People become almost like Hollywood movie stars, and as you know, it's a time when some of people go through change in their relationships, which become temporary for some of them, and will end with a variety of problems during this time. And then you have a rebound, which is becoming people gain weight, and sometimes their weight even doubles. So it's always about how do I maintain, and do maintenance require the same diet? I can only report to you hormonal deficiency and imbalances we can discuss a little bit later, because I also observe a drop of change with testosterone, a change with estrogens, progesterone, and of course cholesterol, which is whole dilemma. How do we just manage? And during this meltdown time, is also might be intermittently increased risk for unstable plaque rupture. What are plaques? We all have them in our vessels, in our micro vessels, which we call capillaries. Capillaries is they are thin about our hair, so they have small also plaques, and if plaque become unstable, can break and lead to microclot or strokes or heart attacks. So my role always, or my I should say role, my interest was what defines stability of a plaque, how we can measure, because it's not what you see, what I said last time, but it's what is hidden in a hole of a donut. Not here, but it's actually not on the but on the side. And we cannot proceed with everybody with intravascular ultrasound, which blows our vessel 360, zooms camera, and shows us what happens in 3-dimension wall of vessel wall. So moving forward, we during this time we observe significant changes in composition of body. We observe changes with metabolism, which some people will become, they cannot eat a lot. There's a lot of like, they can eat very small amount, they have refluxes, even food can back up, and sometimes obstruction can happen, which means narrowing, and they will require secondary surgery or bending to put higher. Gastric bypass surgeries, you have sling surgeries, gastric bypass surgeries, as you know. Various controversies which are more effective. I think that most will come to behavior, which we would become lifestyle. And I have observed because your question will be who was able to maintain weight and who regain weight. I have nurses who lost 150 pounds, for example. I work with MA who became very successful too, but during process of change, they develop iron deficiency, they develop hormonal imbalances, hypothyroidism, underactive thyroid, or presentation what is called autoimmune disease known as Hashimoto thyroiditis, when body generates a lot of antibodies. Also to the surface, all different viruses were coming up. What do I mean? Immune systems suddenly mess down and become more more active towards viruses and bacteria inside and outside. We are trillions of bacteria. We are just good manure or bad manure. It's how you're gonna just call ourselves good soil. I saw patients who had herpes infections of their legs, for example, and it was confirmed with a swab. I have seen a number of people with Epstein-Barr virus. Epstein-Barr virus belongs to herpes type viruses. And there's all question about Lyme disease, chronic Lyme disease. When we observe skin changes, for skin, like I told you, it's not only melting down, but become very dry. What else? It was a challenge to keep the iron level on a desired level. I used not just oral iron, we even had liquid iron, which was compounded by compounding pharmacists, and people have to drink through straw. And always I recommend taking iron with vitamin C to increase absorption. Vitamin D, I'm not sure how much you know, I'm speaking about vitamin D3. Please, everybody, I recommend from all these talks, if you don't remember anything, please just remember vitamin D3. Vitamin D3 is your sun and vitamin. We are light. Vitamin D is pro-hormone needed for immunity, for your natural killers to work. And it has to be balanced with vitamin A. Not everybody is able to convert from carrots beta-carotene to active vitamin A. So I observed deficiencies during this time. There's also endothelial dysfunction, which is we describe as vascular dysfunction, which we can measure as advanced cholesterol testing. We can measure particle numbers. LDL is not just how low I get, but how many inflammatory markers are. HDL, not how high it gets. If you have a lot of what is called HDL high, people think you're gonna get high HDL, but it's protected. There are different subtypes of HDL, and there are particle numbers. If you have garbage truck, which is not unloading, but is staying the same, it's not gonna help you. Finally, if we're gonna move to hormones, we can mention, people think hormones is just libido. I would say it is libido in a healthy way, and very often ED, which is erectile dysfunction, precedes endothelial dysfunction. Endothelium is like this thin layer which covers vessel wall, and it has to be non-sticky, and it becomes sticky, and like I explained before, between walls you start having inflammation. How do we manage it? As a functional medicine and allopathic medicine doctor, for me is the most important that patient stays safe. So I would not initiate testosterone therapy, for example, number one, if I don't know. Patients PSA, prostate specific antigen, which are controversies, how to measure, shouldn't we measure. Number two, I want to know if men, also women, have estrogen dominance. What is estrogen dominance? There is too high level of estrogen, too low, and storing fat tissues often means that there's too much artificial estrogens from environment, were organic pollutants. We wearing all clothing
mm,
which is not
mm,
natural, we breathing air which is not natural. So it is also stuck in human system, and it makes men and women estrogen dominance. As a result, their hormonal imbalances or inability to
mm,
maintain healthy weight or lose weight. We see people who get like a plateau. They cannot. They will just stuck, and that's it. They cannot just get farther. It will require active detoxification, which when I mean active, you already know that my approach is very personal and restorative. I would rather see you going slowly and to maintain your level of activity than push you very hard, because if I would take you to the top of a mountain and you did not adapt yet to change, it can cause more damage than benefit. Yes, I did
mm,
work heart failure clinic, with weight loss clinic, with people also who are on liquid diets.
mm,
Initially, it looks fantastic, but we need to look at like long effects and who maintain. What is positive? Those whose family change and supported, everybody was on the same page. There's healthy food at home, both are going for a walk, they having a circle of nuclear friends and family members who will support them and say, no, we're not going to drink beer because you like beer. We're not going to give you sodas because you like it. So when you have this type of support, it is very healthy support, and you are able to maintain. And I always pay attention to sleep. Why?
mm,
Restorative state of being, which is sleep, or what we call a state of meditation. We're not going to India now, not to dungeon, not to Japans, but we're talking to restorative sleep. When you wake up, you energize for life, not lethargic, because people think I'm ease. If you are just
mm,
ease, nothing is gonna just moving. It is dynamic system. You have to stay focused, flexible. When I mean stability is basis to all creation, to all movement, stable base is not lethargic base. And sleeping a lot, 8 hours, for example, it does not mean that sleep is restorative. You have to wake up energized for life and be able to have appropriate exchange of healthy gases. This is not just only oxygen.
mm,
In terms of toxicity, there are some people who have had exposure to mold, which is another issue, and become
mm,
quite big in certain areas, and it can change whole system. So moving forward, uh, if you want to approach obesity, number one, we need to face it facts, see things as they are. I'm not just a nice big boy, big girl. Just look at the real mirror and see who you are. When I mean see who you are, is not a skinny, because a lot of skinny fat people. We need to look at body composition, which took years of generation to make you to
mm,
this. So if somebody is built like oak, and it's nothing wrong with it. And please, ladies, don't try to be toothpick, because you got your stamina, you build this way, accept and love it. What do I mean? Appropriate body composition, I measure body impedance analysis, which does not measure only a, a total fat percentage, but also when fat amount which are adipose tissue around internal organs, and they determine our risk um, for potential future cardiovascular events, strokes, sudden death. And again, would be surprised that you will see some people who are not like significantly overweight, and they carry this genetic amount of like high amount of fat. And like I saw recently a gentleman who's like fifth generation of men had heart attack around age 50. So it requires really, really
mm,
close attention. And then in Europe, we observe this number of women, for example, they are skinny fat. What do I mean? they look thin, but they don't have lean body mass. Lean body mass are your muscles, which are allowing you to use fuel efficiently, and your fuel will be also determined and based on your activity level. So if I approach somebody whose carbs tend to stick together, I will recommend non-starchy carbohydrates. Non-starchy carbohydrates, simply no bread, no pasta, no rice. What do I eat? There's nothing to eat. And then it goes through sugar, artificial sweeteners. But I would rather answer your question or your audience question than just having monologues. I'm here for you.
Yeah, okay. Um, so do you believe that if somebody kind of like has a liquid diet, do you think that's better than kind of like having an operation, gastric band?
I observe a fast change in weight on liquid diet, and I don't think that is one way approach. I do, I do recommend during initial phase, which we call detoxification phase,
Yeah, yeah,
for liquid. And why? Number one, your body is minimum 72% of what? Water.
yeah, yeah,
What vascular system, your vessels, blood pressure, your lymph. So this is your water. We can discuss all water, what and how, which we're talking about efficient water, which some will excrete everything. So cells are not hydrated appropriately. What else? During this time, probably you have heard about juicing. Why do we recommend juicing? Because it's easier on body, so you quickly digest this amount of food gets absorbed. Then we'll add proteins, and proteins all do I use proteins which are paleo-based proteins, which will be based, for example, beef, which is from New Zealand, which is grass-fed and is just having more lean. Do you recommend pea protein, which is plant for now? Do I recommend whey microhydrolyzed protein, which is very good for athletes? So here I very personally
mm,
approach everything and depends of your response. Overall, when you look at how we human being evolutionarily develop, easier for you will be to digest
mm,
fruit, vegetable, plant-based
yeah,
um, than meat. So overall, I recommend decreasing amount of meat. However, when you look at body type, there's a whole book written about weekend, and I don't want to have here discussion because I saw these people eat right for your blood type, and then it causes different issues. So not everybody is great because they eat or they don't eat something. Just eat right for your blood type.
mm,
Are you aware about eat right for your blood type?
yeah, yeah, yeah,
Because it sounds like usually people like you who come, they'll buy everything, and
yeah,
it's how do we change where we are? And again, I feel that it's important to have to start with healthy. When I mean healthy mind, is not to accuse anybody that mind is not healthy, but mind tends to play tricks with us. So
oh yeah,
mind
yeah,
slap you right and left and create ideologies and links to to philosophy. And having neutral mind, which means clear mind, clear body, it requires us to actively meditate. When I mean actively meditate, you don't shut your mind. If you shut your mind, okay, goodbye, close your nose, God in front of you. Who do you want? Do you want your God, or do you want life? Age with God, I want to live life. So have things very, very real, and remember that breath is extremely important. We need to teach people how to breathe, not upper chest, but diaphragmatic breathing, which as a Kundalini yoga trainer, martial artist, initially I even tell people take some scarf or take belt, put around your waist, and when you inhale, your belly to expand like a balloon, or put your hand on your navel area, and just like start breathing, and don't pump your shoulders up because you're contracting muscles. Very, very easy. And it also causes a state of calmness, state of safety, which a lot of us experience, at least when we were little babies. So it is probably first things which we need to start to have a clear mind, like we clean ourselves. At age 60, they said we consume tons and tons of, I think it was like 80 tons or 60 tons of food. Do we consume this amount of food? We don't. So it is just happening. All holes need to be holy, happy, holy. All holes need to be open. So some people sweat less. Some people sweat excessively. And it does not necessarily mean that they detoxify a lot. System is overheated with a lot of stagnation. Then we go to we start with bowel movement, which is with liquid diet. We see a lot of detoxification during this time, and nutritional deficiencies can happen. And finally, how muscles will become hydrated. So it's body composition and then lymphatic. So it's quite important to mention this change of body performance during transition, and I did observe consequences of it. It's nothing is there are temporary changes. It needs to be then change literal lifestyle and gentle transition here and there. Gentle but wise. And I require, you probably had diary. I require ask people, keep your diary, keep this and that this food. What else? My patients have, I ask them to obtain capillary blood tests or finger stick blood at least. I said, if you don't believe me, when you eat this food, please check within 1 to 2 hours. What is your finger stick blood sugar? What would be even better if we could monitor insulin. Very often glucose, sugar will start stable, but insulin, which is released by pancreas, will go up and down. And it is not, this is what causes inflammation, prediabetes, and the future diabetes, with a large number of people walking with metabolic syndrome, which is prediabetes, which is again coming back, how we sleep, how we challenge the challenge of the day, which is stress, and how our hormones work. Are they harmonized, or are they doing their own steering wheel, doing whatever they want?
Yeah.
So
I think I could sit here all night listening to you because you're very interesting. I've got some messages here for you. Um, Hello, Dr. Monica. My name is Sean. I am 32 stone in weight. I need to get some help, but I'm afraid to go to my doctor.
so his weight is, well, how much? I did not hear.
32 stone.
32 stone pounds, you mean?
Yeah,
And what is
32,
200?
stone. Yeah.
And what is height? Height, we don't know.
Um,
Okay.
I don't know.
Okay, so usually, again, is you're probably aware that people just measure body mass index, which is not adequate description of body composition. I saw people with not bad body mass index have being overweight. So what I recommend, please, very simple things: take your measuring tape, check your waist, check your hip ratio, and also neck.
Yeah.
You you probably are aware.
Yeah.
It's just tell you where you are. So if you're more than 40 for men, 35 for women, I'm talking about waist, you already have a risk for metabolic disease. But questions, not just what do I tell doctor, how do I lose weight, is what are underlying other conditions also, because again, it will determine how tense would be a track which I put you. If you already trained, if you're athlete, you have memory. Everything sticks to us as a super glue. So if you training for marathon per se, or you, for example, box or martial artist, and you already have memory pattern, you want to lose few pounds, you very quickly probably respond to diet, which could be like 2 weeks even, and exercise. Other person we have to take slower track. And again, from all these talks, so remember sleep, restorative sleep. Start with know your numbers. Know your numbers. Please at least check your fasting blood sugar, or even better, postprandial. Postprandial means like 2 hours after meal, and if you can get your insulin level at the same time. Please check your vitamin D3 level. 30, which is borderline, and below is very low. Adequate numbers are much higher for immunity, and also they are needed to manage your sugar and your mood. So your mood will follow you.
Yeah.
So because people, this is not a time to be lethargic. This is a time to be and be and be for life. It's a time to stand. Oh, how will be my mood? How depressed I become? If you in state of lethargy, you are prone to become over time depressed. And yes, your sugar, your weight will change. So I know about challenges. So for now, again, sleep, restorative sleep, taking, if you want, light weights, and you don't have to even run, but having, let me just show you I'm gonna present to you my extension bands. And why? Because everything what I do is practical. So I'm not somebody who will tell you about something what I'm not doing or not working with people. It will be very easy to get any kind. Oops, camera is on this side, I see. So we need to get, this way, this way, this way. I see it. I need to go more here. You can sit. You can literally sit and put your feet on the ground and start very slowly doing flexion and extension. You can start also with your chest. We can go up. Should be done under supervision. And this very appropriate breath is needed during this time. We train people even with heart failure, but I would not start with resistance. Walking, a little bit of body resistance training. If people cannot walk, we move, because people for rheumatoid arthritis or very serious, because whole hips are just, they cannot move. I said, take even, I'm not sure if you train with bike, just arms. And what is time, I will teach people like certain kriyas, which will stabilize their mind. And at the same time, I will talk about the breath, which you will be pumping with your belly button to make your diaphragm, which is one of the largest muscles separating lower abdomen from upper body, stronger. Why it is important? So exchange of and breath become efficient. Everything is efficiency. So I don't know, it's too little to just mention. If somebody have high blood pressure, it's important to have blood pressure under control. If I would just start just making you run and blood pressure shoots to 200, I'm not happy about it. If people have, so it's important. So if they had blood clots and they on medications, we need to watch it. If they had heart attack, we need to also pay attention when it happened. You cannot push everybody just from the beginning, because it can plaques, like we discussed, can
Yeah.
be unstable.
Yeah.
And you're just what you consider healthy, or things which are healthy. Uh, I don't know even age. It's like, what about your sleep? What you mentioned? What about your hormones? I see number of gentlemen now with quite low testosterone number, which is related to change of our normal exposure to what we call light, life, and nature. Number two, diet change, estrogen dominance, and all these pollutants. Finally, EMF exposure, electromagnetic field exposure. They link
Yeah.
all the they're linked to electronics, and they will change your hormones. Hormones are released from pineal pituitary gland. What is down here, it's actually starts much higher. So it
Yeah.
is,
That's
and watching video games and wearing Bluetooth, and they're all different opinion about 5G, which I don't want to just go to this area because of controversy like everything else. So again, this is more complex. I would I provide people. I'm going to show you. I have your wellness. I have also wellness test kits, which is capillary blood test, and what is like if they go to laboratory. Urine test. And again, numbers are numbers. People first. Numbers could be beautiful or numbers could be scary, and people are as they are. So my recommendation is it's showtime. You building your Hollywood stardom of being the best version of you, but it give yourself time, give yourself space, and stay motivated, but not just motivated. I gotta do. Steady pace, focus, flexible, and yes, certain relationship probably will disappear during this time. Again, moving back to gentlemen, I would just start slowly, steady. Um, I'm not sure what is diet. So eliminate again starchy carbs, decrease especially red meat intake because it increases uric acid level, which is one of symptoms of metabolic syndrome. Metabolic syndrome, simplifying pre-diabetes. What is pre-diabetes? Slow burning fire, eating.
We, we'll be talking about diabetes next week. Plus, we'll be talking about diabetes next week and also sugar. We'll be talking about that next week. Thank you so much, Dr. Monika. You are, you teaches me a lot of stuff, and people's been watching your videos, and they love watching you. And thank you very much. And I will see you again next week. And in the meantime, you take care. Thank you.
Thank you. Stay safe. Thank you all. Wish you a Merry Christmas. I'm grateful for all of you.
Thank you very much. Thank you. God bless.
Yeah.
Bye-bye. Bye-bye.
Bye.
Bye. Okay, that was Dr. Monika. And she's very knowledgeable, isn't she, for a doctor? And very good indeed. Very good. Okay, folks, I'll be back around about 9 o'clock tonight. And I hope you join. Well, not 9 o'clock, 9:30 tonight. In the meantime, take care. God bless. Cheerio.